Hello, everyone, and welcome to the International Society for Quality of Life Studies webinar. My name is Jill Johnson. I'm the Executive Director for ISQOLS. We're very pleased to have you all joining us today for this free webinar that we're hosting. And we're extremely excited to have Lucia Macchia. Did I pronounce that correctly?
Macchia, that is
Macchia. And Lucia actually was our first winner for our Best Dissertation Award this past year. So we're extremely pleased to have her presenting. She presented it at our conference. This is a new presentation for her as well. So we're extremely excited to have her here. Just a couple of things before we get started. A reminder that this is being recorded. We will be posting this on our membership forum afterwards. We encourage you to consider becoming an ISQOLS member. In fact, we're going to offer a 3-month trial free for anyone who participates in this webinar. If you are not yet a member, we'll be sending that out after the webinar so you can join us for free and just experience what it's like to be a member with ISQOLS. And if you like, you can continue it and hopefully extend your membership through to next year and join us for our international conference next year in the US in Vermont in August, the beginning of August. So hopefully you'll join us. As a member, you are entitled to a lot of benefits, including access to our membership forum, which are able to get all of this material afterwards. So without further ado, I'm going to go ahead and turn it over to Lucia. Just actually a reminder that we're going to keep all of our videos off and our muted buttons on while Lucia is talking. And if you have any questions or comments during this webinar, feel free to put them in the chat bar. If you take your cursor down and click on chat, and we'll be able to address this at the end. We'll have a time for questions and answers. There's no waiting room required, so if you need to hop on and hop off, feel free to do that and join us at any time. So Lucia, I'll go ahead and turn it over to you.
Thank you so much, Jill. Thank you for the invitation and thank you and hello everyone. Thank you for being here. So today I will talk about my work on physical pain. I will present a paper that was published a few weeks ago and some related findings. I will talk for around 20 minutes and then I will open up to a discussion. I will receive questions and comments. If you have any clarifying question that you think needs to be addressed in the moment before we continue, feel free to interrupt me or as Jill said, put it in the chat and I'll try to answer it in the moment. If not, we can chat at the end. So we will talk about the current situation of physical pain, the context, some literature that is related to the paper that I will present, the relationship between physical pain and the state of the economy. I will also present some possible explanations for those relationships, and we will talk about what can we do as researchers to move this area of research forward. Here we have a graph that shows data from 146 countries. We have the percentage of people in pain in the y-axis and the year in the x-axis, and we can see that physical pain increased from 2009 to 2021. This is all over the world. If we split this sample into a group of rich and a group of poor countries, we can still see the same upward trends. For example, in a group of high GDP or rich countries, we still see that the percentage of people in pain increased from 2009 to 2021. And we can see the same in a group of poor or low GDP countries. We can see that the percentage of people in pain increased in the same time period. The main message of these graphs is that physical pain is a problem that is not only in rich nations and not only in poor nations, so it's a phenomenon that can be seen globally. I think the next good question is why should we care about these rising trends in physical pain? Physical pain is common. More than a fifth citizens in rich nations suffer with chronic pain. Pain increases economic costs. Pain has a negative effect on work and leisure at the individual level. Pain represents one of the greatest public health concerns. Due to the rising trends in physical pain and the importance of understanding pain, researchers started to study this topic. So one paper found that in the United States today, the elderly report less pain than those in midlife, which presents a challenge for the healthcare system, so mainly in the future. Physical pain has been found to be a key factor in premature mortality, for example, deaths related to drug overdose, alcohol misuse, and suicide. Economic conditions seems to be linked to proxies for pain, such as work accidents or accidental poisonings. And social stressors have been found to cause physical pain. However, there's little work on pain with international samples. There are 1 or 2 papers that use international samples to study physical pain. And there's little work on the possible connection between the economic cycle and levels of physical pain. And this is exactly what the paper I will present aims to address. The title of the paper is Physical Pain, Gender and the State of the Economy. It was published a few days ago, and I wrote this paper with Andrew Oswald, who some of you may know. This paper has 2 main goals. One is to understand how the level of pain in society is influenced by the unemployment rate. And the second one is to know who are the individuals who are most affected. Mainly, we wanted to know what happened with the level of pain at the society level when the unemployment rate increased or decreased. And we wanted to know who are the subgroups of the population that were most affected by an increase in the unemployment rate. We used data from the Gallup work poll with survey years from 2009 to 2018, 146 countries. The Gallup work poll is a nationally representative data set in each country and each year, and it contains 1.3 million respondents. Our main independent variable was individuals' physical pain. Did you experience the following feelings a lot of the day yesterday? How about physical pain? Respondents could answer yes or no. For those who are familiar with the Gallup dataset or read papers that use this dataset, this question has the same structure as the questions on positive and negative affect. For example, happiness, sadness, joy, stress, and worry. Sorry. Our main independent variable was the unemployment rate at the country year level, which is basically the percentage of unemployed people in the total labor force. And we also had control variables, for example, demographic characteristics that have been found to be linked to physical pain and also to people's overall well-being, such as age. We included age linear and squared because of prior research, gender, level of education, employment status, respondents' income quintile, so respondents' position in the income distribution, marital status, and number of children under 15 in the household. And we also included macroeconomic indicators as covariate, the GDP and the inflation rate that have been found to be associated with people's happiness and well-being. We use OLS, ordinary least square regressions, as our main statistical model. We also conducted binomial logistic regressions as robustness checks. We found the same results. We conducted logistic regressions because our dependent variable was binomial. Respondents could answer yes or no, and we got the same results. We use country and year fixed effects in our regressions to account for those country-specific and year-specific factors that may affect the relationship between the unemployment rate and pain. We cluster the standard errors by the country year and use GDP measures lagged by 1 and 2 years. The main result is that physical pain is lower in an economic boom and greater in an economic downturn. This can be translated into physical pain is greater when the unemployment rate is high, simply. This is somehow unexpected because during an expansion, people typically work harder and longer, and accidents and injuries increase, leading to greater pain. We can also say that when the economy is slow, when the unemployment rate is high, people work less, and they are less likely to have accidents at work and injuries, and are more likely to report lower pain or no pain at all. Another finding, or important finding of this paper, is that we found this effect principally in rich nations and not in poor nations, and that this was experienced almost exclusively by women. For those who like tables, here we have the coefficients. We have, well, in orange, the unemployment rate, which is our main independent variable. In the second column, we have the regressions for all the 146 countries. In the second one, the regressions for the rich countries. And in the third one, So it will be 2, 3, and 4. And in the last column, the regressions for the poor countries. And we can clearly see that the effect is stronger in the rich countries versus the poor countries. If we take a look at the effects, so this 0.003, what does it mean? An extra 3 percentage points of the unemployment, so the unemployment rate, is associated with just under a 1% rise in the numbers of citizens in pay. If we want to put that effect into perspective, we can take, for example, a country with 65 million citizens, which means that a 3% increase in unemployment is linked to an extra 500,000 people with physical pain, which we consider is a medium-sized effect. Here we have the table with the subsamples. We can, in the last 4 columns, we can see that the effect is strong for people under 60 years old, over 60 years old, people with low education, and people with high education. And most importantly, we can see that the effect is substantially different between men and women. We can see that the effect is stronger in the women subsample than in the men subsample. This is what I was telling you earlier, that the effects that we found, the physical pain increases in a recession, increases when the unemployment rate is high, is experienced exclusively by women. I will present quickly, we can go into details later on the robustness checks that we conducted to show you how robust these effects are. So the main effects hold after controlling for how comfortably people feel they are living on their income. We found that people who report that they are less comfortable, that they are more comfortable, reported less pain. So it doesn't hurt to be comfortable with income, and it hurts to be uncomfortable. The results also hold after controlling for people's feelings of job insecurity, general worry, health concerns, and satisfaction with life, which is a measure that we all like. We also included a 1-0 dummy variable that tests for the asymmetric effect of booms and recessions, similar to what Deneva and colleagues did in their 2018 paper. And we found this asymmetric effect using both the GDP and the unemployment rate. We also conducted the main regressions in different subsamples, and we found that the main effect's still there. For example, using a subsample of unemployed people and then a subsample of those who were employed but not in the labor force. And we found that the effect was stronger in the employed subsample. This means that the main effects are not driven by people who are not employed, because one could say if the unemployment rate is high, the effect may be driven by people who are not employed, and we can say that that's not the case. It's more of a global issue that's going on. And then we also conducted the same regressions with an extended period beginning in 2005, because we were aware that as our analysis started in 2009, we were not considering, or we were just after the 2008 economic crisis, so we took a longer period from 2005. The problem with these regressions is that they don't include income and employment status as covariate, because data before 2009, because data on these measures before 2009 were not available. This is the reason why we started the main analysis from 2009 and not 2005, but the regressions still hold. Some possible explanations. So why do we think that physical pain increases in a recession? One compelling explanation is that there's a link between mental stress and physical pain. So we can think that when the unemployment rate is high, when the economy is low and there's an economic recession, people may suffer from more anxiety, psychological strain, and financial worries that may be translated into physical pain. And this is connected to what I just mentioned, that it's a more global issue instead of just people who are not employed. And then why do we think that women are the most affected? It may be because domestic abuse and violence increase in hard economic times. It may be because there are physiological effects from the consumption of cheaper and less healthy kinds of food. And because there's research that shows that women are more responsible for financial related tasks in hard economic times. Usually during financial recessions, women are more responsible for financial tasks that increase emotional stress that can be translated into pain. So that can be another explanation of this effect. And what can we do as researchers to move this area of research forward? We can explore whether there's evidence for such channels, because the paper that I showed is it's correlational on one hand, but it's at the country level, so it's a fixed effects method, but we still need to evaluate whether there's evidence for those causal pathways. And we can further explore the link between psychological process and physical pain. I will leave it here, and if anyone has any question or any comment or about the study, the paper, or any other related things, I'm happy to discuss that.
Excellent. Really, really interesting information. Thank you so much. Does anyone have any questions off the bat? If you do, feel free to put your question in the chat bar or unmute yourself. People are gathering their thoughts here. Just could you remind, I missed the beginning part of the dates, where the dates of the data that was gathered. Could you go over that again?
So the graphs at the beginning?
Yes, sorry.
Sorry, here we are.
2009 through 2021, all the way through 21.
Yes, well, that's a very good point, because so these graphs show data from 2009 to 2021, but the regressions that I showed show data from 2009 to 2018, because the macroeconomic measures that we used were not available in the moment that we did the regressions, were not available for 2029, 20, and 21. So we were able to show these trends with the full available individual data, but we couldn't include the last 3 years in the regressions because there was no unemployment rate data. So this is why the difference in the time period covered in the graphs and in the regressions. I don't know if that was the question.
Yeah, I just wanted to know the dates, the general span of dates where your data was gathered. And I can imagine if you continue future research, the effects of COVID will dramatically impact this overall research question.
That's another good point. In fact, there's, I don't know, can you see my mouse moving here or maybe not? Yes, okay, so this drop in 2019 may be connected to that. But at the same time, so I don't really have an explanation. I don't know if it's because people didn't report it or people who were in pain died. That may be an explanation as well, but there is something going on in 2020. And also then that drop is present also in rich countries, and it's more pronounced in poor countries. So in the third graph. So I think that it would be nice to have data in the next few years to see what's going on in there.
Absolutely. Hopefully you can come back in a couple of years and present that to us as well.
I will, of course.
Yeah, we have a lot of questions, it seems. So good. We'll jump right into it. Khadija, if you're here with us, if you'd like to unmute and ask your question, otherwise I can read it for you.
I can see it, don't worry. So shall I go with, so this one is, did you control for work-life balance? No, so we control for life satisfaction, job security, and stress and worry and things like that, but not for work-life balance. I can see, I don't know, I'm not sure if there's a question on that. In fact, there's some other research that I'm conducting, considering, so looking at job arrangements and the hours that people prefer to work and pain, that I can show that maybe in my next webinar, but that's a very good point. Thank you. Yeah, it may affect pain or stress. That's a good point. The other one, I'm wondering about the effect being driven by people who are employed rather than unemployed and out of the labor force people. Well, I think that may be so. So the first explanation that comes to my mind is that when the unemployment, and there's quite a bit of research on this, when the unemployment rate is high, people may feel job insecurity. They may feel that they may lose their job soon, because many people are losing their jobs, so they feel that they may be fired. So that may bring stress. That can be connected to pain. That's one thing that I can think of. If you have any other ideas, feel free to unmute yourself and jump in, because that's the one I can think of right now. The second question, have you tried to assess if the effects vary depending on the level of inequality? That's a good question as well. So I ran some regressions using the Gini index as the independent variable, just out of curiosity, and the relationship between the Gini and pain is insignificant. I don't know why. I don't know if there's something going on with the analysis, but that I also had that thought, because that's possible, but I didn't find anything for now.
Okay,
Alan,
thank you. Yeah, Alan has a question.
Yes, great, thanks. Great presentation. I've got a couple of comments really. One is, have you considered just looking at the retired? Because this might get at the link to the economy. So the unemployment rate shouldn't, so the unemployment rate's not going to affect the people who are retired. And maybe that link between the psychological well-being and the mental stress, maybe that link isn't there as well. And it'd be interesting to see if that pattern still exists. So yeah, does the retired people's pain change when the economy changes, even though they're not necessarily that active in the economy? It might tease up that kind of yeah, I'm not explaining myself very well. Do you know what I mean? My suggestion?
Yes, I know, and I can say that the closest we have is the regression with the group of employed people plus those who are out of the labor force. Because, yeah, I think Gallup doesn't have a category that is retired, and this is why we could have tested those who are out of the labor force only, but it doesn't mean that, because we have students, for example, in that category as well. Yeah. So students are usually younger, who are not expected to, I mean, in comparison to older people, right, to experience pain. So that may be whatever result we get there. I can run it just to see what's in there, but whatever result we get, we have to interpret it with caution. Yeah,
it's quite hard to explain it. I was just trying to limit the link to the economy, and then think about the mental stress link as well. And also, I wrote a paper with a couple of colleagues earlier this year that shows that physical pain predicts job loss as well. So the people who report more pain, like a frequency of pain really, or an intensity, the people who report more pain then are more likely to leave their work, whether that's unemployment or out of the labour force as well. So this we might expect unemployment to lead to pain for the mental stresses and so on, but also the other way around is possible too. Yeah, just a thought about causality really.
Yeah, I think that's a good point as well. And yeah, I think that may be explained by the fact that in the unemployed regression, the result was insignificant. So so we have to see if there's any other reversed issue going on in there. But we were surprised by the fact that the main effects were driven by people who were actually employed, which could be connected with the stress and anxiety and fear. So the famous carrying effect of unemployment, that we may fear being unemployed when many other people are unemployed. We also tested, in connection with that, we also tested the interaction between the unemployment rate and being unemployed. And what we found, so to see if there was a norms effect, and we found that people who were unemployed and lived in regions with high unemployment rate reported less pain. which
Interesting.
Is, yeah. So a higher unemployment rate, if you are unemployed, may act as a buffer somehow, as a protection against pain. That's another related interesting thing that we found, that it's not in here.
Yeah, interesting.
Interesting. Thank you so much.
Thanks. Thank you.
Thanks, Alan. I see we have another hand raised. Sergio? Sergio, go ahead and ask your question.
Yes, thank you. Sorry, just a couple of also additional questions aside from the other two that I had listed, and congrats on the paper. It's a very interesting and very thought-provoking too. So the first point, or the first question would be if you had looked, you know, since you found that the effect was being primarily driven by women, whether there will be some sort of additional household characteristics that that would also be related to that. So, for example, number of, or whether there are or not children in the household, marital status, that sort of thing, and whether basically that channel would differ depending on those. The second question is a sort of follow up on also what Alan was asking too. So even though Gallup does not have the retired status specifically, in principle, it should be possible to combine the labor force status with age, so that out of the labor force above a certain age threshold should be, I mean, would be very likely to be a retired person, right? And so then maybe, you know, then it should be feasible probably to, for example, interact either the unemployment rate variable with that labor force status and see if that differs depending on whether, so effectively, if that is higher in people who are not likely to be retired, because that's where the effect should presumably be coming from in terms of pain. Anyway, sorry, I don't know if that was clear or not. Apologies if not.
Yeah, no, perfect. That's perfect. So I will start with the second one, that it's fresh, that we just talked about. I think the interaction, I didn't run it. I mean, I can, because that's a good point. So people who are out of the labor force and are old, those are likely to be retired. At the same time, we don't know with certainty if they are retired, or if they are maybe out of the labor force because of disability or things like that, which may be possible. And also, yeah, I'm not sure whether if we get anything in there how I would interpret it, but it's so certainly the interaction between being out of the labor force and age it's a good mechanism to try to isolate those. I can try and see what I found. Yeah. And the second one, the family characteristics. So the effects, even in the, maybe I can show that again. Let me see. The effects in the gender regressions hold with demographic characteristics and even characteristics, household characteristics, such as here at the bottom we have the list, marital status and number of children in the household. And we also ran the coefficient, because I don't have that here, but the coefficient in each of the men and women regressions, the coefficient of having children, or when the number of children in the household increased, is significant in both of them, in men and women. So that was a difference that we found, which may suggest that the channel of the unemployment rate increase in pain for women is not that they have more children, because I think that and let me know what you think, if that's the case, we should have found the effect of having children significant only in the women regression, not in the men regression. So apparently having children in the household increases pain for both men and women, not only for women. But that's, I think also there are a lot of things that we couldn't test that may explain the women effect. For example, the the number of hours they work, if they are happy with so being an overemployed or underemployed. For example, women who are overemployed during a recession may experience more pain because they are just simply tired and things like that. Or if they are underemployed, they may be having financial difficulties, which brings stress and then physical pain and so on. So the issue is that we didn't have all these measures to test those potential mechanisms. But those ideas are great. Thank you. Any other question, comment?
Alan, do you still have a question? I'm not sure if your hand is still raised from your first one or if you have another comment.
Sorry, yeah, it's still raised from the first one.
Okay.
But another, just a quick query. I wonder if in the data set there's anything about alcohol use as well. There might be a link between physical pain and alcohol use and unemployment that might be quite interesting.
Yes, so we thought about that too. We didn't have a measure on drinking. We had a measure on smoking, for example, but didn't give us anything here. But it's true that in fact there's research that shows that physical pain is a key factor in drinking and drug overdose and these kind of things, which maybe and also one explanation, as you said, so drinking and maybe a mechanism between this in this relationship. So when the unemployment rate is high and people have anxiety and financial difficulties, they may rely on alcohol to solve or to ease these type of things, and that may bring pain because there's research that shows that alcohol misuse brings pain. So that may be another potential explanation. Yes.
Great, thank you. Any other questions, comments? And maybe you addressed this, but with the 73 high GDP countries, I'm just wondering if in your research paper or an explanation of those, if you sparse those out and pinpointed which ones have what are considered higher social safety nets, if that has any impact on just the relation and link between people's low incomes, insecurity, and unemployment insecurity. I would imagine, for example, a higher link with people who have maybe insecurity about job loss and concern about medical costs compared to a country that might have a greater social safety net.
Yes, I think that's a good point as well. So we didn't test that, so that may be an explanation. What I did test is, so this same relationships in the US and everything still holds, mainly because the US was the target of prior research on physical pain, and the trend in physical pain in the same time period is positive. Again, what I don't know is the country variation in, so if the effect, I don't know if the effect is stronger in countries or smaller in countries with a higher safety net. We included country and year fixed effects, which should be accounting for that. So that may not be a reason, but it's true that the effect, even still positive and significant, may be stronger in countries without those kind of services or kind of things. That may be something good to look at.
Yeah, I think it would be interesting to find out. Well, good. I think this was an excellent presentation and certainly some great comments and questions by our participants. Unless there are any other comments or questions, we will go ahead and wrap it up. Just a reminder to everyone that this has been recorded, and we'll post this on our membership forum. Lucia, thank you so much. This was such an excellent presentation, and we're excited to continue following you. And hopefully you can come back to us in a couple of years and present again on your future research that you're doing, and continue to stay in touch with all of us. As a reminder, everyone, our call for abstracts for our 2022 conference in Vermont, USA is coming out in a couple of weeks. So please stay tuned, and hopefully you can all join us in person again in Vermont. In the meantime, stay tuned. We'll be sending out a follow-up email with further details about becoming a member, exploring ISQOLS, and just becoming involved and active in the future events that we're having. So thank you again, Lucia. Thank you to everyone who participated, and we'll hopefully see you soon.
Thank you so much for having me here, and thank you everyone for attending.
Wonderful. All right, thank you everyone. We'll see you later. Bye, Lucia. Thank you so much. Gracias.